Hi, I'm Robert Homm, provider and surgeon and medical director of Fertility and Endocrine Associates and the Louisville Reproductive Center. I wanted to address today assisted reproductive technology, specifically in vitro fertilization. In training as a reproductive endocrinologist and infertility specialist over 25 years ago, in vitro fertilization has made tremendous advances. Advances in drug therapy that have allowed us much more efficient and safe stimulation of the female ovary to produce eggs. Significant advances in the surgical technique for the retrieval of eggs from the female. Improvements in technologies to handle the egg and sperm to accomplish miraculous fertilization of the egg and sperm outside the human body with culture conditions that can keep the developing fertilized egg, called an embryo, safe and sound until it can be successfully either biopsied for genetic analysis and then subsequently transferred to the womb. This takes tremendous planning, as you can imagine. We have the experience and the expertise to handle these types of complex cases, but most importantly, the judgment to know when this technology should be applied, as well as other technologies that can help the couple struggling with infertility. Walking through briefly the process of in vitro fertilization, first and foremost is a discussion with the providers here at Fertility and Endocrine Associates to plan the cycle, to make sure that there aren't any surprises or unanswered questions with regards to what to expect with the experience going through assisted reproductive technologies. After that planning session occurs, we pride ourselves that the patient has a thorough understanding of the calendar, the medications, what to expect, and in some cases, just a little hand-holding to make sure that we take care of the psychological and the emotional aspects of going through the process. But in short, the phases of in vitro fertilization are rather streamlined now compared to how they were 20 to 30 years ago when it was first initiated here in the United States in the early 80s. The process beyond the planning involves stimulation of the female's ovaries with potent fertility agents, which are carefully monitored for safety. When the eggs are ready, they are retrieved in an office setting under comfortable anesthesia. Once delivered to our embryology laboratory, they're carefully analyzed and handled by a specialist, Dr. Stoddart. The egg and sperm are co-cultured to create an embryo, a new life. After appropriate evaluation, and in some cases biopsy for genetic analysis, the embryo is either frozen for return in later cycles or possibly fresh to the partner's womb. The luteal phase, the second half of the menstrual cycle, is maintained with hormone to support an early implantation and developing pregnancy. And then 12 to 13 days after the embryo transfer, pregnancy test. If successful, the patient is maintained and monitored for approximately 8 to 10 weeks. And with the expectation of all going well, referral to the patient's OBGYN for ongoing monitoring. The process sounds certainly complex, and in some cases it can be. Again, we trust that patients understand all aspects of in vitro fertilization with the careful counseling that's provided prior to the start. We have the knowledge and the expertise to help you. Please contact us if we can help you.